Cataracts in developing countries is truly a humanitarian emergency.
What causes the cataract?
Well, we don't know what causes it exactly, but we know what happens, but not why it happens. There are a number of factors. Little babies can be born with cataracts. We know what forms those in some cases. If the mother has German measles in the first trimester, there are certain congenital and familial conditions and genetics involved that may be responsible. Traumatic things, hitting the eye, can frequently result in a cataract forming. There are climatic changes, the light rays, the infrared and the ultraviolet light rays over a period of time in the agricultural communities, and all seems to be those people develop cataracts at an earlier age than in the Western world. The Western world, cataracts may form in the late 60s, 70s, 80s, 90s. In the developing world, many places it'll develop in the 40s, 50s, and 60s.
And why is that? Why is it earlier?
Well, we don't know again why, but it's the environmental factors maybe, and nomads that live in tents where and people in huts and things like that, where they're constantly from the smoke from the cooking fire, and so there are all of these kinds of effects. And other diseases, diabetes, a diabetic patient can develop cataracts at a much earlier age. So there are a number of different causes that can occur.
Now, you made a point that it is a humanitarian issue. Why is it that more of the world organizations are not involved in terms of trying to help your organization or other organizations?
Sure. Well, actually the WHO, World Health Organization, along with the International Agency for the Prevention of Blindness, has an initiative called the 2020 Vision. They hope to reduce preventable blindness by the year 2020 in significant ways. And it's an advocacy program, global, to encourage countries to develop prevention of blindness programs and sight-saving programs. We're part of that. The surgeons are part of that. But public awareness and the decision makers have to be involved with that too. And there are a number of factors involved: the lack of facilities, the lack of trained personnel, the lack of microscopes, microsurgical instruments, the lack of consumable supplies, and the lack of political will. Political will. Yeah. And there are a lot of priorities, economy, defense, agriculture. I mean, there are a lot of things tugging at the governments to solve these problems.
There are amazing stories in your biography and your website about people when they first see for not seeing for such a long period of time. How does that feel for you and the surgeons when you have that experience?
Well, it's about the biggest high you can have when you know that with your hands and your training and the support of the support personnel, they're the nurses, technicians, and others who have made that possible, to get that blind patient in a room on a table with a microscope and the instruments for 20 minutes and to profoundly change their lives is an amazing experience. And we can do it over and over and over again. And these clinics are generally short-term clinics. They're 4, 5, or 6 days. The local surgeons have to have an infrastructure. They have to have the approval of the health and civic authorities. We have to get invitations from the surgeons before we will go into an area. And we don't operate in huts or tents, only in hospitals and where the local surgeons operate. Maybe a national eye center, such as in a number of countries, or a very modest facility, a surgery center. But the highest standards are maintained. We require that our surgeons from the United States are certified by the American Board of Ophthalmology, and we like to work with our foreign counterparts with their highest qualifications in their countries. We have educational exchange programs going on, and it's a cooperative venture. It's not just a giveaway type thing.
Because of those standards, does that limit where you can go in terms of the countries you can go to?
No, not necessarily. It's we have to have the invitation from the local eye surgeons and the health and civic authorities.
And how would that come about?
Well, we have guidelines that are set up that are on our website, actually, that list the responsibilities of the host doctors. They must agree to get these documents and the support of their social service agency or service club or whatever it is in that country. They agree to pre-screen the patients for cataracts and to take care of the patients post-operatively. Now, I know sooner or later you're going to ask me how many surgeries you can do in 3 days.
Tell me.
All right. Basically, it depends on the number of local and visiting surgeons. We keep our team small, 1, 2, or 3 eye surgeons, surgical nurse, technician, maybe an administrative type. 5 or 6 people maximum is the best. They bring all the supplies to do a pre-agreed upon number of surgeries. And in 3 days, 3.5 days, or 4 days, 50, 75, 100, 150, or 200 blind people can have their sight restored.
Amazing.
Yeah, it really is. And we've worked out, the See International organization was developed to provide the surgeons with as many of the non-medical and surgical aspects of these trips as possible. The logistics, the diplomatic arrangements, the customs information, the procurement of supplies, the transportation, et cetera. And so the surgeons can be busy doing surgery. And that's what we're known for. We're ruthlessly efficient at doing just that. Yeah.
You also said the host countries have to do pre-screening. So when you show up there, the people are already pre-screened and are ready to go through the process.
That's correct. Now, each surgeon has to convince himself that that patient is the
candidate.
Is the proper candidate, sure. Yeah.
And then they have to take care of the patient after the fact, after you leave.
That's right. So the number of surgeries is important, but you can't do so many. I mean, how would you like to be left with 125 post-op cases to take care of? Yeah. Fortunately, with cataracts, they require very little care unless something goes wrong. If they develop an inflammation or infection,
like that,
they must be checked. They must be checked. So we only work with qualified ophthalmologists. And our program really is not a program for resident doctors or retired doctors. The requirement is you have to be in active surgical practice to participate with See International.
So you have to be up to speed in terms of your
You
qualifications.
Bet.
That's amazing.
And we tell our visiting surgeons that if they wouldn't operate on their mother, father, sister, brother, child, or uncle on a circumstance, don't operate on those patients. They're just as important as any of their patients in their private practice.
Doctor, do you find that this need is mostly in developing countries?
Yeah, well, sure.
Do we find, countries that have good medical health have this need also?
Yes, there are many countries that have excellent ophthalmologists. That's where all the blind people are, and more surgeries done in these areas than in the Western world many times. So the surgeons can be extremely capable and accomplished. The techniques may vary, and the conditions and so forth, but we learn from each other.
You learn from each other.
Yeah, at these.
So this is a collaboration, as you said earlier, where you're working with doctors around the world too.
Sure.
That makes it a unified force.
Yep.
It really makes a big difference. For you, what is the future of this organization? Where do you want to see it go?
Well, I would like to see my vision for the organization is that in every country in the world where there's an ophthalmologist, we would have a See International ophthalmologist.
Wow. Yeah.
Now we're already in 75 or 80 countries, and I think there are 212 or so in the United Nations. There are a number not, but that's very doable.
It's very doable. Yeah, of course it is. Funding, do you have trouble with that?
Well, sure. However, for every dollar that is donated, about 97% cents 97 cents out of every 100 pennies go to the direct delivery
Directly
of
to the
surgical eye care.
organization.
Yeah,
It doesn't go to administrative cost.
yeah, 2 to 3% for administrative costs
That is unique for
for
nonprofits.
the
like that.
value
Very
of the
unique.
services